We are now live. Hi, this is Dr. Echefu. We are live now. I hope you guys can hear me. So I'm going to add on Dr. Achimugu right now. Let us see if she is. Let me add her now. So let's wait for her to join us. I was actually having a discussion with her before I came on live. So yeah. So how's everyone doing today? So today's Saturday. Hey, hi Marcus. Let's see, Dr. Chimugu. I invited her. So she is. So she has joined. Invite. Yeah. So let's see. Why is she unable to join? Finally. What
Hello,
happened?
hello.
Hello, how are you? Can you see me? Can you hear me?
I can see you and I can hear you very clearly. Can you hear
What happened
me?
though? It took us a while to come in. What happened?
So yeah, I think me just happened, to be honest.
I'm just asking
So,
so that I know what to do next time, just in case it's coming from my own end. That's why I was asking.
I went on, I thought I was live already and I was saying hello to you, but you weren't responding. So I thought, so maybe we're not quite connected, but we are now.
Connected. How are you?
I'm very
Finally.
good. I'm
Now I'm
very
going to
good.
throw you under the bus a little bit.
Oh,
I
are
want
you
everyone
now?
to know how hard it was to get in touch with you. Like, I had to cry. I had to
Oh my
beg. I had to say,
goodness.
what is going on? Please answer my messages. But finally, I'm glad that we're here.
I have to say, I'm really happy to be here.
I know
So,
you're happy.
yeah,
I know you're
yeah.
excited, even from talking to you before we came on now. I mean, I can see that. So, Dr. Chimugu, can you introduce yourself for our audience today?
Well, hi, everybody. My name's Eliojo Achimugu, and my background, I'm a pediatric surgeon and I'm a hair transplant surgeon based in London, UK.
Okay,
That's me.
awesome. So, most people don't know hair transplant. You're a hair transplant surgeon. What do you mean by that?
Actually, I prefer calling myself a hair restoration surgeon.
Me too. Me
Yeah.
too. Me too. It sounds like sort of.
Yeah, no, and exactly. Just because essentially, it covers. It says what it means on the tin, right? We're trying to restore hair, and we
Yeah.
use surgical and non-surgical means to
Yes.
help, be it bring back edges, deal with
Okay.
brows, help people prevent further hair loss.
That's awesome.
So that's part of what I do.
Okay, so you help people. So that's how you help your clients. Everything about hair loss. You help them restore their hair. I can say confidently now, you help them restore their confidence too.
Absolutely, absolutely. Because I think
Yeah.
maybe yesteryear we forgot the importance of hair and you
Yeah.
forget the potential impact. But
Hmm.
you can change your look so easily by changing the color of your hair or even addressing the texture of your hair. So I think hair is really important and yeah, it impacts people, not
Yeah.
just women, in different ways.
Yeah, because I watched a video on your Instagram, the May Clinic,
Hmm.
and I watched like a young lady, she came in with her hair, and I think how you helped her and all that. I just watched the whole discussion and the video. It was very impactful. So
Thank you.
thank you for what you do.
Oh, thank you. And I guess this is where I should highlight I work as part of a team. So every
Yes.
member of my team, honestly, thanks also. This is for all of us.
Yes.
And obviously the people that we collaborate with as well.
Oh,
So
that's awesome. Well, thank you for what you do still. Thank you for what you and your team, you guys
thank
do. Thank you for
thank
that.
you.
Okay. So how can people find you?
Sorry.
How can people find you? Like, say, our audience, how can they find you?
Well, yeah, Instagram is one thing,
Okay.
but quite. I guess my name's unique or relatively unique. I would say Eliojo, Eleojo. So look up Dr. Eliojo, and you will find links to the main clinic. The May Clinic, we're in central London. We're based on Harley Street
Okay.
and have a second location nearby. So essentially, if you go to our website, so the May Clinic, do I need to spell it out? THEMAE Clinic.
I mean, it's pretty much easy. The May Clinic,
Yeah,
MAE.
it's quite
Yeah.
straightforward.
Yeah, it's quite straightforward. Yeah.
Yeah.
Yeah. Awesome. 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 So they can find you on Instagram.
Yes. A website, Top Doctors. Yeah, quite a few
Top
places.
doctors,
I
and they
guess.
can and they can also find there's a
Yeah.
website, the May Clinic, right?
Yeah.
Yeah. So
Absolutely.
okay, awesome. So that was easy then. So now our discussion is going to be talking about today. Our discussion is interesting. Why is interesting is that we're talking about a specific set of people
Okay.
with curly hair. You
Yeah.
know why is important is that we're trying to make people aware what is possible for them. You
Hmm.
know
Hmm.
because a lot of people when they present to my clinic, especially their question is this possible? Can I do this? Can I have a hair transplant? I've gone to some clinics and they turned me down. They said I'm not, what the kind of machines they use, they can do, Afro texture there or Afro curly hair. So that's why our discussion today is important, is just to raise more awareness about hair restoration, especially
Uh,
for those sect of people, which we are included.
yeah. People that
So
look
that's
like
why
us.
it's important today. So tell me how
Yeah. Oh, you are breaking
some
up.
of your can you hear me?
If I'm looking blank, I
Oh,
can't quite hear you.
you can hear. Okay, I said, how often your clients, majority of your patients, do they have Afro curly hair? Or let's say how in percentage wise, how often do you meet people coming into your clinic that have Afro textured hair? How often do you meet those?
Do you know, I reckon the best way to answer that is that that number is increasing, and it's
Mm,
based on something you've mentioned already, awareness. I think in the
awareness.
past, my split would have been 80% men, 20% women of
Mm,
all ethnicities and
ethnic-
all hair types.
mhm,
And over the last few years, more and more women are realizing that hair transplant as a means of hair restoration is an option for them. So that number is increased to 60-40.
oh, wow.
Now, within that group for women, more and more women with curly hair, textured hair, and hair like my hair type are realizing that actually you don't have to be sidelined anymore, and you don't have to stick to one particular method for hair restoration. So again,
Beautiful.
so that number is increasing. So I'd say it's probably still about 50-50
50-50. So
within
you
the
mean
group for
50-50
women.
men, women,
But
50-50%.
60% men, 40%
Yeah.
women is what I found so far.
Mhm.
And I'd say actually, I guess I love the variety within what we do. So
Yeah.
working with straight hair, working with curly hair, working with
Mm-hmm.
coily hair like my own, I love that. And so
Love
that
that.
number like is increasing more and more. And maybe having shows like yours will help increase awareness even more. So,
That's right. That's right. And that's what we're doing here today. So, quick question. What are the key consideration in an Afro curly hair? What are your key consideration? Let's say someone dealing with hair loss
mhm.
and they're trying to know what are their options out there. Is this just hair transplant or there are other, treatments you do in your clinic to help them?
Okay.
For someone that hasn't made up their mind just to do hair transplant or they are not even a candidate for
Mhm.
hair transplant. Is it
Mhm.
just hair transplant that you just offer to them, or there are other options what they can do?
Okay, so I'm a surgeon. I love
Mhm.
operating, but people hear me say this over and over again. It's only fun and it only makes sense to operate if it makes sense. So
If it makes
if
sense,
you walk through the
correct.
door,
I
don't
love
worry.
that.
I'm not just going to operate on you
I love
if
that.
it doesn't make sense. if you're not a suitable candidate, if it's not the right thing for you. So having the patient center, front and center, is the most important thing. So that takes us back to what's causing the hair loss in the first place. So that's the
Mm.
most important. Let's get to the bottom of the cause of your hair loss. And in most people, I'd say women especially, unfortunately, it's a myriad of things that could be contributing to that hair loss. So what do we do next? Correct the correctables. So if your iron is low, for example, we can help you with that. But obviously the most important thing is correcting that underlying contributor to hair shedding or hair loss. So yeah, absolutely. So at the May Clinic, we do offer non-surgical means for hair restoration as well as surgical options for hair restoration if you fit into that category. And like I mentioned briefly before, we work with dermatologists, trichologists. So essentially, it's all about finding out what that individual patient requires and making sure we create a tailored plan to address the hair loss.
Okay. So what are the examples of non-surgical options you offer?
Okay, so mesotherapy. So where again, this is assuming the cause for hair loss is
Yes, yes,
identified.
yes,
So
yes.
mesotherapy, not everyone's great with taking tablets, but
Mhm.
even then, if for some reason you're not a suitable candidate for taking anti-hair loss medication, there are
Mhm.
things that we can do to help prevent further hair loss, to help boost your other treatments. So
Mhm.
mesotherapy essentially just means introducing medication or something at the level of the follicular unit. So
Mhm.
it involves introducing that through the skin, using a
Mhm.
needle sometimes to get
Mhm.
the drug,
Yeah.
the
Whatever
substance
you're
that you
using. Mhm.
need.
I
Absolutely.
got it. Mhm.
Yeah, so essentially it's not a one size fits all. You need to
Mhm.
identify what's going on and find the right thing for that patient. So that's one of the things that we do. Um, why am I drawing a blank? What else do we do? That's not surgical.
So, so you do a lot of non-surgical, and the
Yeah,
point
we
is
do.
that it's not
Yeah,
just hair transplant. That's what we're trying to get at today. It's not just hair
absolutely.
transplant. That's why you
Absolutely.
prefer to call yourself hair restorative surgeon or hair restorative physician, right? So I think
Yes.
I get the concept now. So people, because once you say you're a hair transplant surgeon,
Yeah.
people are like, oh, she just does only hair transplant.
Yeah. I think
So
yeah. So yeah, I agree. It's good to make that
yeah,
clear. So there's
got
room
it.
for
Okay,
front where it's appropriate, but there's also room for non-surgical things.
got
So
it.
yeah.
Yeah, okay. So, and also your second point is, or your third point is that they also Afro textured or Afro curly hair
Hmm.
can qualify for those other
Oh,
treatments.
absolutely, absolutely. Because in the end, to think about it, like
Mhm.
hair is hair. The follicular unit is still a follicular unit, so that's the base where your hair grows from. But curly hair, I guess you want to tailor treatments to different hair types, and a risk with curly hair is, I guess, the most important message I find getting out to most of my patients with textured hair is about hair care as well. Just because obviously we want to make sure that your scalp's healthy, the hair that grows out, we want that to be healthy, but we also want you to maintain the health of it, because people sometimes get stuck on looking at hair length. We want great hair density
One
as well as
great hair
length.
density, because most people miss the mark. They think it's the length. It's not by the
Yeah,
length.
yeah, but you're not going to get or maintain that length if you're not doing the basic things to help care for your hair. And then you're not going to keep the density, whatever it is that we do for you, surgical or non-surgical, if you don't quite know how to care for it. So all of us just need that help along the hair restoration journey. So when people first meet me, when they come to clinic, essentially we're educating to say, actually, this is a journey, however long it was
Mhm.
before you met me, whatever journey you've been on before coming to us. We just need to be it sometimes simplify things or clarify it so that we assess your goals, set the goal, and work together towards achieving that goal on a journey. I sound
Okay.
repetitive, don't I? But
No,
hey,
you
this
don't.
is you.
The more, the better. It's okay. The more you say it, people at the back can hear you clearly when you say it.
Yeah, yeah. It's a thing from med school, isn't
Yeah,
it?
yeah, yeah. Okay, now. So what are the key considerations? Like,
Mm,
when someone walks into your clinic,
mhm,
curly hair,
mhm,
textured hair, Afro curly hair, whatever I
mhm.
want to call it. What are the key considerations when they walk into your office, when you're doing your examinations and all that? What are
Mhm.
the key concepts? What are you looking at? What are you looking for?
Okay. So, yeah, you want to know obviously how that person is. They
Hmm.
share their story. What quite often people have been on a journey before they find a hair restoration
Correct.
surgeon,
Correct.
and someone who knows how to handle Afro textured hair.
Correct.
I think quite often the story, unfortunately, is feeling dismissed in the past.
Hmm.
Um, and because our hair can appear quite full,
Yeah.
and in fact, this is for all hair types. If you've got really full hair and you notice a change, your hair is beginning to thin, not everyone necessarily appreciates
Hmm.
it, but you may pick it up early. So people have this story of being dismissed, and then finally they get somewhere where we're listening. Yeah.
Okay.
So you do that, and then it's looking at, okay, what's happening with your scalp and what's happening with your hair that could be contributing to the thinning, the breakage, the loss that you're describing to us,
Correct.
and that involves like a careful assessment, including like your medical history, the story that's led to where we are today.
Hmm.
Um, but also a thorough assessment of the scalp. Do you know, we want to get an appreciation of what might be going on beneath the skin. As a surgeon, I say I like to keep things simple.
Hmm.
So essentially, trying to identify, could this be a scarring alopecia?
Current alopecia.
Is it a non-scarring alopecia? And that reminder that the word alopecia simply means hair loss, and that's our medical description for hair loss, right?
Right.
So, and in the end, for all of us, again, I like to remind myself that hair loss is a sign. It's highlighting something else that may be going on in the body. It
That's
may
right.
just be a nutritional deficiency. I say just. Let me drop the just.
I
It may be a sign.
understand.
Yes. Do you know, it's, I mean, our field is really exciting, isn't it?
Yes.
Because there's so much
So
potential.
many causes of there can be 200 causes of hair loss or hair
Telling
shedding at
you.
the same time.
Yeah, for sure, for sure. So it's finding out that individual story, then looking at what the hair is showing me and what the scalp is suggesting, and then simplify actually which category are they in. Do I need a friend to join me in managing this patient, or is this something that's appropriate for us to, for me as the surgeon to manage? Yeah, by
Manage the
my
hair loss. Got it. Okay,
great.
so you are saying now, let me ask you now, is a yes or a no?
Okay,
So
okay.
Afro curly hairs,
Hmm.
can they qualify or can they do is hair transplant an option for
An
them?
option, absolutely, yes.
Thank you.
Is that four yeses?
Yes, the four yeses. Number two, what is their so now does the surgeon matter? That's my second question when it comes to hair transplant. Now we're going into hair transplant specifically now. Does the surgeon doing that's going to do your hair transplant, does he or she matter? The person actually going to do the hair transplant.
So let me answer in this way and say their skills matter, their approach matters, their understanding matters. So especially with curly hair, just because as you appreciate, straight hair, the angle at which the hair leaves the skin is the angle at which it enters, right? So beneath the skin, it's straight down. With curly hair, you can have a curl that's like a J curl, like a proper O. So if you're not with someone who knows how to
Okay.
handle our hair, textured hair,
Mhm.
then actually the risk is of damaging a limited resource, which is the donor
Mhm.
area. So I do believe that your surgeon matters. I
Got
do
it.
believe the
Now, let me
approach
be
matters.
biased a little bit. I mean, if they have to prove to you, I do Afro textured hair, you better not, don't go. If they have to, work so hard at proving to you. No, you don't have. Mm-mm,
Yeah.
mm-mm, mm-mm,
But I also
mm-mm.
think, like most things, the equipment matters. If you want to go
Thank
skiing
you.
and
That
you
was
don't
my
have
next
the right,
question. The
yeah,
equipment. Mm-hmm.
yeah, that makes a big difference.
Mm-hmm.
So you can have the equipment and you need someone who knows how to use it.
How to use
So,
it.
and who's also committed to
The
training, to keep
training.
training. And
Okay.
that applies to
So
all.
so you're saying the first thing is the surgeon matters,
Mm-hmm,
and their list, the way they listen and handle you,
mm-hmm,
it
mm-hmm. Uh,
matters, and their knowledge,
yeah,
it matters. Then number two, you said the machine they use matters too.
the equipment,
And
absolutely.
the equipment, the machine, everything, it matters. Yes.
Yeah.
Okay. So is there some machine they need to be looking out for, or you just don't want to name anything? Is there any specific machine or equipment you want them to know? Hey, this is the best one, or you just want to just say no, whatever, whichever one they
Well,
should use
what
their
I'd say,
best judgment.
there are lots of things out there. So if you have someone who's not skilled, doesn't know what they're doing, with the best equipment in the world, you may not be walking away with a hair transplant. But I can tell you what I currently use in my clinic, if that's the question. So we've used, in fact, I'm a gadget queen. And but I'd say I have to be honest. I've tried a number of machines, if you like, for hair restoration, and the Zeus has been a game changer in our clinic for Afro textured
Me
hair.
too.
So yeah,
Mhm.
so yeah, I think we had a chat before you purchased,
Yes,
right?
yes, yes, yes. Remember, we had a chat about it. I'm like, hey,
Yeah.
because people come to you once they see you, they see the surgeon, they're like, okay, I think I can trust this person,
Mm,
before they talk to you.
mhm,
They see you, they'll say, okay, I think I can talk to this physician.
mhm.
Then now, if you don't have the right equipment or machine to take care of the hair, you
Yeah.
can talk all the talk, but what about the result?
Well,
You see?
it's, do you know, I might phrase that slightly differently and say, obviously, it's about, do you know, not sweating so much
Yes.
is actually with the right skill. In
Hmm.
the end, the tools don't make the surgeon.
Yeah.
You need that combination. You
And that's what
absolutely need that combination.
people asked me this question about the robotic hair
Mm-hmm,
transplant, the artists. So
mm-hmm.
I get a lot of questions about the artists, the robotic hair transplant.
Yeah.
I actually always tell them, like, it's not the machine, it's not the equipment, it's the surgeon.
Yeah, you need that combination as things
Mhm.
stand.
And most
Try as
Afro
much as you can,
textured
because I
hair
don't.
or curly hair, most
Mhm.
Afro textured or curly hair, they actually don't, use artists hair transplant. Most Afro textured hair, they don't apply for that because I think it's a robot and it was programmed for just straight hair, some textures
Yeah.
of hair, but
So what I'd say is actually whatever hair type that we're managing, it's
Mhm.
you want good quality grafts. You want to minimize the transection rates. Um, so it's really about the quality of the work. You don't want to spend forever doing it. So actually, if you've got the right equipment, it does make life easier. I've used a variety of things, and I love them for different
Mhm.
things. And
Different.
yeah, for different things. But
Mhm.
I remember speaking with you about the Zeus, and just if one was going to get one machine that would do everything, I'd say,
Mhm.
okay, that's the one I would go to.
Okay.
But I do things where I love, Dr. Umar, don't kill me, but I love. So for me, the goal is using the smallest punch, the smallest needle that I can safely get away with in that donor region. Some of my colleagues believe in that, some do not. That's fine. But in my journey, I found that actually that makes a difference. So again, for each patient, it's finding the ideal procedure
Idea.
for them,
Yeah.
and using the best equipment for them. So, but for
Okay.
Afro hair, absolutely, this is
Yes. You
sorry.
know why it is important when you talked about
Yeah.
punch size, the
Mm-hmm,
smaller the size. Now, because especially Afro textured hair, um, they're always afraid of scars,
mm-hmm,
you know,
mm-hmm, mm-hmm.
scarring.
Mhm.
after a hair transplant,
Mhm.
visible scars and all that.
Mhm.
And that's usually my top one, or not top one, on number two questions they always ask me, like,
Yeah.
I see all these scars and all that. Am I prone to scarring? Am I going to get scars? What, they always want to know the plan towards, avoiding visible scars. So what do you say to
Mhm.
that?
So again, this is where again we're tailoring it to the individual patient in front of us. If you have someone who's prone to adverse
Mm-hmm,
scarring, someone who's has a proven history of keloids, for example,
mm-hmm,
I would take, it's extra care with that. That being said, I do believe the follicular unit excision method is still appropriate in cases like that. But when I have a patient like that, and if they're suitable for a hair transplant, I tend to do a trial procedure. Do you know, a few years ago, we had a meeting in Salvador, Brazil,
mm-hmm,
where you had a collection of surgeons, and I loved it for the fact that it was all about hair transplant in textured hair, in Afro
mm-hmm,
textured.
mm-hmm,
And it was interesting where you had this group, this international group from all over the world, and
mm-hmm,
actually the actual percentage or the report of adverse scarring due to a procedure that's done properly is actually really little.
Oh,
So
wow.
I think there's a lot of fear around it.
Mm-hmm,
That being said, it's not a thing that should be dismissed. So if there's someone with whom I'm not quite sure, a trial procedure is something that's simple and straightforward to do, where you do a test patch essentially, look out for what the results are, and then you can tailor the main surgery
mm-hmm.
around that.
Around
It's
that.
better to be safe than sorry, right?
Safe than
So
sorry. That's right. No, that's right. That's right.
yeah,
So even though scarring is a thing, having scars is a thing, you can still get a hair transplant, but you have to be aware of everything.
absolutely. Yeah, I mean, you can't just rule out a whole group of people and say you can't
You
have a
can't
hair
have
transplant.
hair transplant. I know, I
You
know,
know?
I know, I know.
So,
I know,
and
I know, I
unfortunately,
know.
like you mentioned
So now let
earlier,
me throw a question to you now. So what should, now I am a client, I'm someone looking for hair transplant.
okay.
What should I, what let's say, what should I consider before I select a hair transplant surgeon? What should I consider? Is there something for me to ask about, to look out for? What are the right questions or things to look out for before I select the right hair transplant surgeon?
Okay, so I would say take a look at their history, examples of their work, um, look at so surgery. We talked a lot about surgical skills,
Mm-hmm.
but there's also looking at what as the surgeon signed up to. So you've got the International Society of Hair Restoration Surgery. I'm
Okay.
in the UK, so I'm going to big up the bars, the British Association of Hair Restoration Surgeons. So both societies I'm a
Mm-hmm.
member
Yeah,
of,
yeah, I know.
and of course I'm part of the African Society of Hair Restoration. But that being said, it's not just about being a member of that. The question is, what ethical standards do these bodies hold us to?
Mm-hmm.
Because you and I, we own our businesses. We work independently and with groups of other doctors. But it's finding someone who's choosing to be accountable, willing to be
Accountable.
accountable, willing to work with other colleagues to help improve. It's a new field, it's a growing field, and there are lots of different practitioners within it. So you want to select someone who is not afraid to share their work,
Mhm.
who is signing up to, continually improving within this field. That's one of the things I'd say.
Okay.
But of course, someone who can correctly handle Afro textured hair.
Yeah. So you're saying they should go to ishrs.org
Yes,
to look,
that's what I said.
that's what you said, to look, I just want to say it again so
Yes,
that people at the back can listen, can hear that. So they have to look for the physician on that. If
yes.
you can, what about if you can't find the physician on
Number
ishrs.org?
one, I would be surprised, but but you could also go to bahrs.org. Yeah, and if you, obviously come to the May Clinic, come have a chat.
I know they can come to the main clinic. I mean, they can come to the main
Yeah,
clinic, I have a chat. That's right. But
absolutely.
you're trying to
And if you're
guide them
part,
because. they might
Yeah.
also go to the website looking for you. so
Yeah,
so
no,
that's why. So she's there, so you are gonna find her.
yes.
So they can come to your clinic knowing that they're in the right hands.
Yeah, no, absolutely. I'd say that.
Awesome,
And if you're
awesome.
far away, we can help connect you with our colleagues
Colleagues.
as you,
That's right.
yeah.
That's right. That's right. So what is three best advice you give to clients before a hair transplant and after hair transplant? Before and after. This is more advice, what you talk to them about that is very important
Okay.
that they need to know. Hmm.
So I would say, okay, first, reminder that a hair transplant will help fill gaps where it exists.
Mm.
It doesn't do anything for the underlying cause of hair loss. So, if you've got traction alopecia, if you do a beautiful hair transplant and then you start, you can still style your hair. If you choose to continue to put that pull force there, then you're essentially reversing the work that we've done. So
Mm.
um, and for people with male pattern hair loss, female pattern hair loss, if you're not doing anything about the underlying cause of that, yes, we'll do the hair transplant. But some years down the line, again, that underlying condition progresses,
Mm.
be it slowly, but why not take steps to help, slow it down and keep
Okay.
your hair as long as possible. So that's one thing. Number two,
I mean, I think I think you've said
I said quite.
two things now about traction and alopecia, and
Yeah,
also about importance of medical treatment.
yeah.
So you
So maintaining that.
said, yeah, so you've said two things. So just the last
Yeah.
one.
So,
Even if you don't know the last one, that's okay.
no,
We can
well,
move on.
it's one that it's not quite specific to your
Yeah.
question, but what I would say is if you notice hair loss, seek help
Seek help
early.
early.
Yeah.
Got it. That's the best
So,
advice. That's the best one.
yeah.
Okay, so for after post hair transplant care, what is your three main, you know,
My
out of the
three
park?
main
What
things.
is the best
Oh,
advice?
well, so patience, be patient.
Patient.
So that,
That
yeah,
really hits home. Yeah.
and that applies to us surgeons as well. So the hair is gonna grow. It's been transplanted. Now it just needs
Time.
time to grow.
Yeah.
Don't add stress to it. Stress is not gonna help with hair growth.
Yeah.
Yeah. And,
And it's not even in hair transplant. Whatever treatment you're going to do for hair
mm-hmm,
loss, it takes time.
mm-hmm, mm-hmm,
So it
mm-hmm.
doesn't even matter. Like, just hair transplant is that you're not seeing the, that is you
So,
planted something, you're waiting for it to grow. So,
yeah, exactly.
so that is the
That's
hardest part. Mhm.
Yeah, it needs to take root. It needs a bit of time. And then, honestly, yeah. And typically, I'd say to people, you may notice hair growth before that. Many people do. But the
Mhm.
main thing is waiting past that 6 month mark. I think that's an important mark. So it just at least helps to take away the anxiety that can be
Exactly.
associated with impatience. So that's
Exactly.
one thing.
So
And then
patience. So patience number one.
patience is number one. And then
Okay.
number two, I say to people, avoid strenuous physical activity for 2 weeks.
Mhm.
Yeah.
Okay.
So and that's just to essentially don't want you getting carried away and then you're wiping sweat away and wiping
Mhm.
work away. But
Mhm.
more importantly, the body will divert blood flow to essential organs. It's not thinking you had a hair transplant yesterday. So so that would be one. The second thing. Do I have a third thing? Oh, I don't know.
It's okay. If you have to. I mean, the first one,
They're
patient, just is
important
the
things.
best one.
Yeah.
The patience one you said is just the best. Is just the best one I've heard. Like just patient because it hits home. Because
Mm.
I realize there's so much anxiety about will my hair grow or not grow. I'm like,
Yeah.
I'm
Yeah.
also anxious. So don't think I'm not
Yeah.
anxious. I'm also as the I'm also anxious. I'm like, did I do the right thing? Why is it not growing? So your surgeon is also anxious. That's what I tell my.
Yeah. No. I mean, it's good that we check ourselves,
Yeah, we
but in the end, I'm like,
just have to
yeah,
check out.
take a chill pill. So maybe there is a third thing. My third thing will be then enjoy the journey. The work's been done now because in the end, you want to enjoy the hair that's been put there. So care for it,
That's
but
right.
enjoy that
That's
journey.
right.
Yeah.
So enjoy the journey. That's also
Mm.
good. Yeah, enjoy the journey. Yeah. Oh, awesome. Okay. What is I mean, I think you basically all our questions we've basically gone through everything. The most important one I wanted to point out is that Afro textured hair, curly hair. We have so many options,
Yeah.
we're not
We do.
just, don't think that we don't have options that you're gonna because most people say I've used all this castor oil, mint green, oil white, which are all this herbal tea tree. I'm like, it's
Yeah.
okay. I'm not saying don't use
Yeah.
that. But when you're dealing with hair loss is progressive.
Yeah, it is progressive.
So
And
you
like
gotta
you said
deal with the
before,
underlying issue. Like, don't put a
exactly, find
band-aid.
out
Don't put a
what's going on.
band-aid.
But I'd say over the years, and I'd say maybe one of the key things I've learned personally for me, and something that has changed for my family and
Mhm.
also for my patients, it's that statement of, or learning. We don't have to oil our scalp. So
Thank
if
you.
I have an opportunity to say something, is you know what, do not oil your scalp. Obviously, you're caring for your hair and all of that, but
Mhm.
please do not oil your scalp. I think that's a chat for
Yeah.
another day, but
So maybe
it's
we might
just
come back and talk about especially oiling of the scalp because I'm telling
yeah,
you, I
or
have
not.
problems. That's why when I go on some shows or
Uh-huh.
interviews and they will ask me so many questions, I try to
Throw
please
that in
don't
there.
take, these oils you're using, all these supplements that you're taking, you don't need it.
Yeah, I mean some are
If
good, but just don't oil your scalp. I
exactly,
think I'll get a T-shirt made. Do not oil your scalp.
do not oil your
Yeah.
scalp. Okay. I mean, that would be a question, something for another day. Another day. So, what is one key factor in a successful hair transplant? One key factor.
Preparation. Preparation,
Preparation.
both on the
Mhm.
surgical side and for the patient
Preparation.
preparation. So be it
Preparation.
calculating what you need for the procedure you're about to do. Do you know it, all of yeah, my
Got
one
it.
word. Yeah.
So, preparation means whatever questions you have in your mind, you dreamt
Mhm.
of, you read, ask your surgeon. Do not
Absolutely.
assume
Yeah. Or suffer in
or
silence. There's
suffer
no need.
in silence.
Yeah. Well,
And if they're giving you a kickback or if they're not answering all your questions and you still have some doubt, don't go ahead. Don't do it.
yeah, absolutely.
Don't do
Absolutely.
it. I
In the
promise you. Even
well,
mm-hmm,
most people have had a hair loss for a while,
mm-hmm,
and so it's worth being patient beforehand as well.
mm-hmm,
Just be sure that you're comfortable, and then comfortable to proceed. If you're, actually, I love it when people ask me questions because number one, it means they've read. We can engage. I'll know what's going on
mm-hmm.
in their mind, address things as appropriate, and
That's
if
right.
yeah, do you know, and dismiss what's not appropriate. Do you know what it takes?
Yeah.
That's why I keep saying we're on a journey
Mhm.
together, and that requires communication both ways.
What is one false statement about hair loss that you've read that kind of, irks your spirit? Like, or
Mm.
you've heard, or you've seen, or you've,
Oh,
watched a video, something. What is something that has, troubled your soul?
okay. So something that has propelled what I do, and it would be actually, it was, and it's changing, thankfully, but it's
Mhm.
that story in the past that women with Afro textured hair could only have strip surgery, and I'm like
Thank you.
that,
And when you say
like
strip surgery, please explain for our audience, like, they don't know what strip surgery is.
Okay, so essentially, with hair transplant, all we're doing is carefully moving follicular units, grafts as we call them sometimes, so hair from a hair-bearing region to a
Mm-hmm.
non to a non-hair bearing region, so the bald area, the edges that are gone, or to the brows. Yeah, essentially you've got hair somewhere, you want hair elsewhere, we move it from the initial site. Now, originally, the way of a hair transplant was taking a strip of skin that requires incision. It's a good operation to do. It's an option for hair restoration, but it involves taking a strip of skin and then cutting it down into the follicular units and placing that in the area where you need hair. Now, with curly hair, we mentioned before that actually, as the hair goes beneath the skin, it can trick you a little bit and curl propel in lots of different directions. So the danger or the risk when you're doing follicular unit excision, and that's so follicular unit excision is the risk of damaging that graft beneath the skin. So in the past, where the right equipment didn't exist or where people weren't skilled in doing follicular unit excision in people with curly hair, the only surgery that was offered is that original surgery where you remove a strip of skin from the back and you end up with a linear scar that can be beautifully covered with your natural hair. But the fact is, you have options. And I think it irks me when maybe people aren't informed of the options they have. Strip surgery is an option for straight hair, for curly hair, depending on what your original hair density is. Um, but however, follicular unit excision is also an option, not just for straight hair, but also for curly hair. So, yeah, like I said, it irks me and it saddens me really where women are told, oh, the only surgery you can have is the strip surgery. But you know, now we can do follicular unit excision without shaving.
Without
So,
shaving, that's the
yeah,
best thing
it's so
ever.
exciting.
I
It's so
know.
exciting.
I
So I'm
know.
like,
Without
that's
even
a
shaving your hair,
more
ladies.
rights.
You heard she
Yeah,
said it.
and
Without shaving your hair, you can do hair transplant. So there's no excuse for you.
yeah, yeah. So that's why I'm like, you know what? Let's not tell a group of people that you can only have one thing. That's a bit unfair, right?
That's unfair, yeah. Or maybe the problem usually is that if the surgeon can do the other type of hair transplant, they'd kind of, try and tell the clients this is the best for you. I
It
mean,
makes you
guess.
sad as well because as doctors, if there's some like I don't operate on the nose, so if someone came to me with a problem to do with their nose, I'd refer them on. So it's the same principle within hair restoration, and again, that's why I believe surgeons are members of the BARS, the British Association of Hair Restoration Surgery, or members of the ISHRS.
Hmm.
All of these things, people that are choosing to be accountable. Um,
Yes.
accountable with each other, with colleagues. I think that's important. So that's one reason I say look out for those marks.
That's right. Oh, this was so good. This discussion was so good, so knowledgeable. So you see, you heard it here first. She said, you don't have any excuse now. And I'm going to
Yeah.
hold all my ladies accountable now. You don't have any excuse. Hair loss, you have to come in and get seen first.
Yeah.
Evaluation, consultation is important. That's what she's saying.
We
So
have
there's no
options.
excuse to say, I don't think this doctor told me no. This doctor told you no doesn't mean that it's really a no.
Yeah. No, of course.
Yeah, yes, yes. This was really good. So how can people see you one more? How can people find you one more time for the people that are just coming in? Because I
So,
want them to find you. I want them to, I don't want them to miss out. If they're dealing with hair loss. I don't
thank
want them to miss out. Like, please tell them where they can find you one more time.
So the simplest thing is go to our website, themayclinic.com. So that's
Mhm.
THEMAE clinic.com.
May Clinic.
Yeah,
Okay, I'm just typing it out for them so they can May Clinic. Okay,
thank you.
so I'll send it. Okay, good. Okay, so thank you so much.
Thank you for having
Thank you so much for coming. I hope you enjoyed
I,
this discussion. I hope
I,
it was not a lot.
it's always fun chatting with you. So I'm glad we got to do this here.
And I want to thank you personally because you've been so helpful in my journey too. Like, seeing the ladies doing it, like, in hair transplant because it's a male dominated field, you know. So seeing one of the ladies that have inspired me. When I went for
Oh,
the initial when I went for the training in what was the training there? The one they do every July.
oh yeah.
Doctor,
Like,
yes.
yeah,
Yeah,
hair 360.
yeah,
Yeah,
the
yeah,
one I went for in July.
yes.
I kept on looking for someone that had a different name
Oh, really?
that sounded familiar. I'm like, I don't see anyone. I'm just the Chefu. Every other person was a David, a Steven. I'm like, I
You're
don't
like
see.
a woman.
There's some names that will stand out.
Okay.
So when I saw your name, I kept on saying, who is this? Who is this? Who is this? And I kept on hanging around until I saw you. And remember, I was one that talked
You
to
did
you
some,
first,
yeah,
came up to you first, because I
yeah.
was like, I felt comfortable.
Oh,
I'm like, okay,
oh,
there's somebody, and I intentionally took your number, your email. If you remember, I
yeah,
did it. I didn't. I don't wait for. I look for what I knew what I was looking for. I'm like, I need to have people I can relate with. Like,
yeah,
there are struggles there. It's not
yeah,
everybody that can understand.
yeah.
So I wanted to
That's
make sure that I had someone I could talk to. Remember when I wanted to buy the machine too?
yeah,
Guess who
yeah.
I came to? I talked to you. I'm like, what do you think? And you were just saying, you can buy this, you can buy that. I said, no, what do you think? You said,
Yeah,
this is what I use. I said, say no more.
yeah. No, that's
And
the same.
remember when you came back and asked me, what did you buy? I'm like, I bought the same machine, the equipment that you're using. Like, I mean, it's not a no-brainer because if it's working for you, if you're successful in your clinic helping people,
Yeah,
especially with Afro texture here, who am I to, go against the odds, like, or go against, like, what is already working?
yeah.
So that was not really that was so thank you so much. And I want
No,
people to know I'm saying thank you now. Like, so thank you
then,
so much that directing me, helping me out, like, putting me through, like, in this journey because it's a hard journey
and,
becoming a hair transplant surgeon.
mhm.
So thank you so much.
Do you know, it's a right pleasure. People have been kind to me as well. It has been a journey. That's another chat.
Yes.
But I think it's important that we keep
Yeah,
collaborating
sure.
and we. So yeah, that's my
Yeah.
thoughts.
Thank you. Hopefully one day we're gonna have a training for,
Yeah,
people that
absolutely.
want to be a hair transplant surgeon. That is gonna
Absolutely.
be in the works for me. That's one thing I'm thinking about. So hopefully, like, because I want people to, know that there are options, and this is just one of it. We are there, and we're not going nowhere, and we're not going anywhere.
Yeah, we're loving what we do, so we'll keep doing
Okay.
it. Okay.
So thank you so much.
Thank
Okay. So I'm
you.
gonna sign up now.
Bye.
Bye bye.